realize how serious the threat is around you. High volumes of droplets and aerosols are produced by high-speed handpieces and ultrasonic scalers. High and low-volume suctions cannot completely remove aerosols. Droplets and aerosols splash and attach to the dentist's faces, hair and clothes. Blood splashback is produced during treatment. Aerosols contain bacterial and viral particles unable to be seen by the naked eye. Aerosols become attached to the dentist's bodies during treatment. Coronavirus, flu virus and other viruses can be spread by droplets and aerosols. Don't worry, we have the extraoral dental suction system. Droplets airborne. Use the extraoral suction system to terminate droplets. This will help reduce bacterial and viral infections. Blood splashing. Remove blood sprays. To defend against cross-infection. Threat of bacterial and viral infections. Use it to eliminate airborne bacteria and viruses. Will help defend dentists and assistants from bacterial and viral infections. The extraoral dental suction system has ultra-strong suction power to capture various harmful particulates effectively. Its 3-layer filtration system with HEPA filtration technology is proven